Hi, Dave from Align Therapy here. I am going to discuss a research article that I saw recently that came out in February of 2024 that looked at lower extremity alignments and muscle strengths and foot characteristics in those who had scoliosis. I think this is a very interesting article because it's something that we look at when we're treating scoliosis, and we see some differences in alignments and strength and things like that. So it's really interesting to see an article that looks at this specifically. So I wanted to go through it. The title of the article is Association of Scoliosis with Lower Extremity Alignments, Muscle Strengths, and Foot Characteristics, and Their Alterations in Adolescent Idiopathic Scoliosis. So they're looking at strength and alignment specific to the population that I see most, the scoliosis population. So what's really interesting is what they found. Don't forget to subscribe to the channel. If you like research review like this, make sure you subscribe to the channel and watch for more articles that I'm reviewing. These aren't way in-depth reviews like we're doing a scholarly peer-reviewed thing. This is more to discuss what we can glean from the research that's coming out, those things that we can use to help us treat scoliosis better, live with scoliosis better, things like that. So subscribe to the channel, look in the description below. I'll have a link for the article, and you can check that out as well. So let's get into it a little bit deeper. So one thing that I look at when I look at a research article is how many subjects this article has. So this has 31 participants, which isn't a huge size of a study. So it's not something that's way strong, but it's interesting. 31, it's enough for me to start looking into it. So there were single curves. There were 7 people who had single curves in this study. There were 14 people who had double curves, and then they had 10 who were controls, so who didn't have scoliosis. So they tried to split it up so that, because single curves are going to change the imbalance or the alignment of the lower extremities more than double curves usually. And so they looked at this. I won't go into specifically how they examined the lower extremities of these participants, but the results is where it kind of gets interesting. So they said scoliosis was associated with Q-angle, arch indexes, and all lower extremity muscle strengths except for hip extensors and ankle plantar flexor strengths. So if we boil that down a little bit, because that's pretty heavy, the scoliosis was associated with differences in Q-angle, so the angle of the hip, the femur that goes down to the knee, arch indexes, so the foot posture, and lower extremity muscle strengths, except for hip extensors. So hip extensors, there wasn't as much of a difference in scoliosis versus non-scoliosis. And plantar flexors, so your calf muscle isn't as influenced by this. So comparisons among the 3 groups showed significant increases in lower extremity alignments and foot characteristics in adolescent idiopathic scoliosis. So it found significant differences with these groups. Then the most interesting part to me, almost all lower extremity muscle strengths decreased in adolescent idiopathic scoliosis, especially for single curve groups. So that was really interesting to me. This is a small sample size, so we can't totally infer that this is happening in everyone in the general population. But it says that almost all lower extremity muscle strengths were decreased with AIS or adolescent scoliosis. Very interesting. When I test people in the clinic who have scoliosis, adolescents who have scoliosis, I do see a reduction in strength usually. Sometimes that's asymmetrical, sometimes that's bilateral, but it's interesting that this is showing that all lower extremity muscles are weaker. I don't know exactly why that would be. Some of that might be because they might be less active, or they might be more concerned about their scoliosis. I don't know exactly why we would be seeing as much of a difference in the scoliosis population with lower extremity strength just generally. But it's an interesting thing to think about because it's something that we probably should address as we treat scoliosis as well. Not everyone who has scoliosis is going to have weaker legs or lower extremities, but it's something that we probably should address. The conclusion of this study, they write, apart from spinal deformity, the adolescent idiopathic scoliosis has changed in lower extremity alignments, muscle strengths, and foot characteristics. Therapists should consider these associations and alterations for designing proper management. And I totally agree with that. We should be aware that there are changes in muscle strength, in foot posture, in multiple areas of scoliosis, especially the adolescent population. And we should be aware of those and address those. If we're seeing an imbalance or a weakness or something like that associated with scoliosis, I feel like addressing that can yield better results than if we just look solely at the spine. It's interesting because this study is looking at the legs and how those are being affected by the scoliosis curve, which is above. Normally we're looking at scoliosis as a spinal problem or back pain or something like that, sometimes up into the neck, sometimes down into the low back and the pelvis. But how often are we actually looking at the legs? How often are we looking at foot posture? How often are we looking at the strength of individual muscles of the legs? And if you're a provider who treats scoliosis, definitely look at those things. Don't just get so focused on the scoliosis that we miss other things that are going on. If you're a patient or someone living with scoliosis, or you're concerned about how scoliosis might be affecting your body as a whole, I think it's a good thing for you to look into if you're having some weakness or some posture issues in your legs and in your feet. So I wouldn't go to just anyone to check this out. A podiatrist, you might go to a podiatrist and they want to put you in custom orthotics. You might go to a general physical therapist and they could check your strength and help you address that. But what I would really suggest is going to someone who specializes in scoliosis, that does the Schroth method or the SEAS approach, or does something that is specific to scoliosis, that they can help guide you and how to address the scoliosis component as well as the other components that you're seeing, like weakness or alignment changes in your legs. And who better to look at that than someone who sees scoliosis all the time? So I would suggest looking for a Schroth method practitioner or someone who is really comfortable with scoliosis and asking their opinion, getting some ideas on some exercises to strengthen those weaknesses that they find or you have found. And you can definitely look at some of our other videos that we have where we talk about strengthening the shoulders or strengthening the core or the legs associated with scoliosis. And I'll put up more videos that have to do with strengthening specific areas. Specifically the hips is one thing that I really want to focus on. How to strengthen the hips with scoliosis to provide more balance in the muscles. So watch for that, and hopefully this was helpful to kind of go through. I'll put the link for the article in the description, so check that out. And as I go into this research article more, it's interesting that it's a little bit more interesting to me, and I think there's a lot of promise in addressing scoliosis patients as a whole instead of just a curvy spine. So thanks for watching and stay tuned. We'll do another one of these.